Health Minister Dr. Joe Phaahla has visited the Kalafong Provincial Hospital in Pretoria. This after 2 days of tension on its doorstep. Operation Dudula supporters have reportedly been checking people's nationalities before allowing them to enter the facility. The Health Department has condemned the action, and our reporter Pule Letshwiti-Jones is there at the Kalafong Hospital to give us an update. Pule, what happened during the minister's visit? How was the reception and environment there?
Well, Maseko, maybe firstly let's start with saying that the minister was delayed. A program that was supposed to start at 10 a.m. hasn't started till now. He was supposed to actually go on a walkabout in the hospital here, but at the very same time convene a media briefing to address the media regarding what he has assessed when inside the Kalafong hospital here in Atteridgeville. Outside, it's a different scenario. We saw the scenes that happened yesterday repeating itself. I'll just step out of camera so my colleague can show you. The Operation Dudula members who were here, of course, have now been hauled away by some members of the EFF as well, who maintain that undocumented foreign nationals should continue to receive medical care and have access to medical care. But, of course, Operation Dudula on a different stance here, saying that shouldn't be the case, that undocumented foreign nationals and foreign nationals should be paying when coming to have access to healthcare facilities here, but most importantly that South Africans should be prioritized. A different scene today also, coupled with that, we're seeing that there is more police presence here as well, who are actually here to enforce the law, to ensure that nothing spirals out of control. But of course, like I just said, members of Operation Dudula are nowhere to be seen. They have been, of course, forcefully removed away from this doorstep here again by members of the EFF. It's quite, unfortunate as to what we're seeing. We're being told that they were violently removed by the Red Berets, and this is the reason why we're actually seeing members of the SAPS here. Maybe if I can just step again on my right-hand side, my colleague Tammy will show you the EFF kind of getting ready to address whoever they will be addressing again, and this is the situation that is currently unfolding here.
It looks quite tense there, Pule. Do you know if the minister is going to be coming out to that particular spot to speak to Operation Dudula and EFF members?
No. From what we're getting or gatherings, that insiders are saying he has to follow protocol. It will be quite dangerous if Minister Joe Phaahla has to walk outside. That's why they've asked him to actually be here as well. It seems to be like a bit of harassment as well, coming from some members of the Red Berets as well, with the media being told not to be here. One must also say this picket has been hijacked by a group of other members who are not wearing EFF regalia. We don't know where they're from, and seemingly they've been quite, negative and heated towards the media as well, quite hostile. So you can imagine the kind of scene unfolding here, as you can see, as the EFF continues to take a media session, an impromptu one, by the way. It's just on their reaction as to what had happened, of course, with the clash that had taken place between them and some members of Dudula. Maybe let's just take a listen, Maseko.
People to access health care in Kalafong Hospital, which we feel that we must put a clear message to the South African Police Service, which now they are sleeping in the same bed with Dudula, because they have obtained a court interdict from the Gauteng Division, the High Court, but they are still questioning whether the intercourt interdict is legitimate or legal. So it's a problem to us as the economic freedom fighters, because the South African Police Service is promoting black-on-black violence, that we need to fight with these people, because they are only here to watch us. They are not doing anything, they are not calling order, they are not dispersing the crowd as it is, the group of protesters as they are instructed by the court interdict that was ruled by the High Court in Pretoria.
But there's never a need to fight. Why did you get into violent scuffles?
Who's fighting?
We witnessed for ourselves between EFF and the Dudula people.
No, I have not seen that fight. I have not seen that fight. We're not fighting here. We're here to make sure that our people access Kalafong peacefully without interruption. And as we speak, our people are entering inside the Kalafong hospital. Fine.
any message that you want to tell the Minister of Health who's here?
Comrades, let's have the eNCA not here. We will not want to fight, comrades. Comrades, we will fight. We will fight.
Well, there we go. We've just been told to actually step away from that media briefing that has been taking place here. But of course, what we understand is that the reaction we're getting from members of the EFF is that they wanted members of the SAPS to execute that court interdict that was actually launched here, which says that there shouldn't be any members who are actually blocking the entrance to the hospital. Subsequent to that, we just want to get a bit of reaction to hear what furthermore are they saying from their side, because we've also gotten aside from members of Operation Tudula, but you saw that also they of course said that we should step aside, which is what we'll do for safety reasons for now. But most importantly, before we let go, I just want us to take a listen to what Union Nehawu had to say yesterday in terms of a particular, today rather in the morning, in terms of a particular stance they're taking when they're saying their patients are at risk and that police officials should actually act and ensure that their workers are actually at safe hands when having to operate at Kalafong Hospital.
Our members and workers in general are being inconvenienced having to come to work, having been asked to produce identity documents by total strangers in order for them to prove that they work here or whether they are patients coming here. It's an inconvenience. But we think that it's very myopic thinking that as poor and working people, we must harass other poor and working people who are just looking for health care, who are not in this situation because of their own doing, but because of the challenges that they are having. These are poor people who only just need health care. So, but we just think that the way that it is being done is not correct, that firstly that workers are being disturbed in coming to their workplace to do the work that they must do. But secondly, it's just ridiculous that it is our own black people who are targeted for these things, because you see people of other races are not being harassed. They gain entrance very easily. So it's heartbreaking, but we just think that it's small-mindedness what we are witnessing here.
All right, Pule, let's just leave it there for now. Try to keep safe. We don't want the story to turn from Kalafong Hospital and the issues there to become about eNCA and the EFF. Calls are increasing for African traditional medicine to be brought into the mainstream medicine arena. This as Wednesday marked the 20th anniversary of African Traditional Medicine Day.